The integumentary system. The skin is the first line of defense against pathogen. The cell growth happens in the bottom of the epidermis, and the cells push upward to the surface. The bottom layer of the epidermis contains melanocytes. The dermis contains elastic and collagen fibers, as well as blood vessels and nerves, hair follicles, glands, and nails. The skin regulates temperature by dilating and constricting blood vessels and activating or inactivating sweat glands. Sebum functions to keep hair and skin soft. The shape of the hair shaft determines if the hair will be straight or curly. The nerve receptors in the skin transmit feelings of heat, cold, pain, touch, and pressure. The thinning of skin and decreased sebaceous gland activity reduces an individual's temperature control. There is a decrease in the number of melanocytes at the hair follicle. This causes the gradual loss of hair color. The presence of friction, shearing, or pressure are risk factors for skin tears, as well as impaired sensory perception is also a risk factor for skin tears. A skin tear is considered a preventable and a traumatic wound that occurs primarily in an older adult. Because of this, the Centers for Medicare and Medicaid do not reimburse institutions if a patient acquires a skin tear while being treated. Keeping the skin clean and dry is a vital nursing intervention. The Healthy People 2030 initiative is to decrease occupational skin disorders and diseases. A biopsy is used to differentiate benign from malignant lesions. Culture and sensitivity is used to identify causative organism and the best drug to treat the skin issue. A wood light allows ultraviolet light to inspect the skin. Skin patch testing is used to determine if an individual has any allergic reactions. A macule is a circumscribed flat area with a change in coloration. An example would be a freckle. A papule is an elevated solid lesion. An example would be a wart. A vesicle is a circumscribed superficial collection of serous fluid, like chickenpox. Plaque is circumscribed, elevated, superficial, solid lesion. An example would be psoriasis. A wheal is a firm edematous, irregularly shaped area, like an insect bite. A pustule is an elevated superficial lesion that is filled with purulent fluid. An example would be acne. If the individual has any crusting, scaling, oozing, ulceration, or change in the lesion's surface, they should notify their healthcare provider. Lesions should be assessed using the ABCD acronym. A is looking at the symmetry. Is it asymmetrical? B is looking at borders. Are the borders of the lesion irregular? C is for color. Is there any color change? And D is for diameter. Has the diameter changed and grown by 1/4 of an inch?